When we work in our clinical practice, we will see that 1 in 5 patients that are admitted with a stroke, actually it's not the first stroke, it's the second or third stroke. So about 20% of people with stroke being admitted with a recurrent stroke is kind of devastating, because when I talk to a person after stroke, one of the things they say first is, what do I do so that this never happens to me again? And even though we can see in Swedish documentation that 70% of those who are admitted with a recurrent stroke were actually already on an antithrombotic. So it doesn't mean that these people didn't take their medication. Some of them probably didn't, but overall that is probably not the problem. So many people still have a recurrent stroke. And I think there are many reasons for that. Because, antithrombotics are very, very important, but there are also other issues that we can work on. We have to be aware that the risk reduction from antiplatelets is about a third. So there's still 2/3 of the risk left. But there's also the risk of smoking. There's also the risk of being physically inactive. There's also the risk of an inadequate diet. There's also the risks of untreated hypertension, badly controlled diabetes, etc. So there's a lot of things that we should work on, because 1 in 5 having a second stroke is not very nice.